Dr. Dheeraj Masapu. Welcome to my channel. So there are many requests which have come to my channel for me to do a video on pathway to settle in Dubai as a specialist. So today we have Dr. Jamil, who's we both have worked together in a corporate hospital in Bangalore. But right now he is working as a specialist in one of the hospitals in Dubai. So welcome, Dr. Jamil, to the interview.
Thank you, Dr. Dheeraj. Thank you all. Thank you for having me on your channel.
Thank you, thank you. So this video is about the pathway to Dubai after doing MD or DNB anesthesia in India and finishing 3 years of a mandatory SR-ship if somebody is there. For that person to come to your place or to become a specialist in Dubai. So what is the pathway starting to ending? If you can tell us in a very simple way, it will help many of the subscribers.
Okay, sure, Dr. Dheeraj. Yeah, in the UAE, you have 7 emirates. 3, there is an Abu Dhabi, which has a separate health department called Health Authority of Abu Dhabi. And for Dubai, you have a Dubai Health Authority. And for the rest of the emirates, that's out of the 7 emirates, these 2 emirates have the separate health authority. And other northern emirates like Sharjah, Fujairah, Ajman, etc., they have something called as a Ministry of Health. So it depends on where you want to come in UAE, whether you want to settle in Abu Dhabi, or Dubai, or any other. You have to take respectively. You have to take like for example, I stay in Dubai, so I take Dubai Health Authority. Right? If similarly, like if you want to settle in Abu Dhabi, you got an offer in Abu Dhabi, you have to take what is called as a Health Authority of Abu Dhabi. That is hard examination. So I'll be speaking only on the Dubai Health Authority. The process which the audience required to know. So as you know that you have a 3 posts here. One is a general physician, that is general practitioner. Another is a specialist in the respective fields, and the consultant post. In the specialization, you have only 2 licensing practices. One, specialist anesthesiologist. Another is a consultant post. So for Indian degree, pure Indian degree, we have like MD or post DNB. After that, we have to have a 3 years of experience in their respective countries. So after that, you will be eligible to what is called as a specialist anesthetist. Right. So after this, if you want to apply for a Dubai Health Authority licensing, you have to have 3 simple steps in approaching that. Step 1, you have to do what is called as a self-assessment on a DHA website. It is free, where you can just log in your details, like when you have completed your MD or DNB, and when you have like how many years now. So it will give you whether you are eligible to apply for the specialist. So next is what is called as a manual assessment. So after that, there is something called as a single sign on the DHA, where you have to create your account and you have to upload your details. This requires a fee, one-time fee of I think 220 to 240 dirhams. So 1 dirham is now equivalent to 22 INR. Right? So accordingly, you can give the INR values. So I'll be speaking on IAD, that is dirhams. So it will be constant throughout. So after this, you have a 3 to 4 working days where they will review your degree and the dates. If they said okay, then you have to go for a step 2. The step 2 is again split into 2. One where it's called as a primary source verification or data flow. Data flow is a company that is they'll outsource this document verification. Okay, so there they'll verify 4 or 5 degrees, that is a good standing certificate from your medical council. Then a license, that is for us like Karnataka Medical Council or Maharashtra Medical Council. Like that, you have a medical council certificate verification, or your degree certification like MD or DNB, that they'll verify. And more importantly, your experience certificates in that 3 years. So each document they'll charge around 220 to 240 dirhams. So approximately on an average 4 or 5, depending on the experiences. If you have stayed in one place after MD for 3 years, that will be 1 document. But if you have split it into 2 or 3, then document increases. Accordingly, the price will also increase. For each document, verification on data flow or primary source verification is 220 to 240 dirhams.
Okay.
So approximately 5 on an average it will come. So it is around 1,000 dirhams.
So that is
which is
like
approximately
25,000 roughly.
Yeah, approximately 22 to 23,000 dirhams. So after this, and I just want to clarify here, majority of the doubts they'll get from my colleagues or the new those who are applying is we have a different dates on our degree and on our convocation. If you have observed, in say in an MD degree, the passing date is different and the convocation date is different.
Yeah.
I request to all the people that who are applying to put what is there on the convocation dates.
Okay, I've got it.
Because that is the document which you are submitting to them. So they will see the dates of the convocation because exam passing date, it will not be appearing on our degree. This is the most common, the clarification and, the procedure will be get delayed otherwise.
Got it.
So this once you have submitted simultaneously, this will take verification. So once you submitted this to data flow company, that is primary source verification, they will take some 30 working days to verify and to give their report. So they will confidentially they'll ask for all this respectively and they'll take the report. And simultaneously you have to prepare yourself to take the exam called as a CBT. That is computer-based test, also called as a Prometric test. Prometric is a company again which takes outsources. It will take the exams. So this exam is usually a multiple choice questions. For us, like for the specialist anesthesia, it has 150 questions.
Okay.
And it will take 165 minutes. Timings will be there,
MCQ.
and no negative marks. No negative marking.
Multiple choice questions.
And passing percentage, if I'm not wrong, it is 65%.
Okay.
Okay. So this is the exam-based one. So you can take your exam being at home, like Bangalore or wherever the centers are there listed in the Prometric website. You can choose wherever you want, or if you want to visit and see the Dubai, and you can come here as a center as well.
So basically, you have to pass the Prometric multiple choice questions, correct?
Not necessary. See, you have to go simultaneously. Earlier, what it was when we applied, like you have to pass, and then you have to get for your documentation verification and all that. But now you can do simultaneously to make this process a bit faster.
Okay, got it.
So once you are to apply this verification, this as I told you, each document takes 220 to 240 dirhams each. So you have at least 5. So it takes another 1,000 dirhams. So next is Prometric exam. As I told you the details, so it is $280 if I'm not wrong, which I got recently done for one of my friends. So $280, so which is approximately 1,025 dirhams. Yeah, another 1,025 dirhams will be the charge. So these are the expenses for everything.
50,000.
So once you get all this, once you get through all this and you get all your documentation clicked, I mean, there will be once you visit the website, after your single, there is something called as a Sharian portal. That is like a portal for health licensing issuing authority. Okay, so once you enter this, you will get once you clear everything, you will get what is called as a eligibility letter. So this eligibility letter is valid for 1 year from the date of the issuance. So with this 1 year eligibility, you can apply for the jobs.
Okay.
Also, if there is any vacancy in the hospital, you can apply with the eligibility letter and they'll contact you, and the license will be issued only when you join the facility, that is the hospital. Only when you join the hospital, then only you'll get a license.
So after the eligibility letter, so what are the best chances that people have, like with your experience? Like for example,
getting a job. Getting a job in UAE, especially now, you have to be a little bit proactive. in the sense you have to approach in multiple ways. Like one, you need to be in contact with the people who are already working in UAE. Okay, and you can forward your CVs, and like they can forward it to the head of the department whenever there is a vacancy available. One. Second, you have to be active on the LinkedIn LinkedIn portfolios. And third is like you have to be active on their respective hospital websites, where there is an options where you can upload your CV and all that. The third one. The fourth, of course, you can visit on a visit visa and apply. Just go through the hospitals around. Just meet the head of the department, meet the people you know, and like advice, that will increase the chances of getting you the job there.
Got it. So the whole pathway explained in.
And also one more thing I want to add is about the agencies.
Okay.
There are agencies who are working constantly, like they will put you to the hospitals and they'll charge you the nominal fees. But one thing is you have to be a bit careful about the scams going around. But any agencies which ask money upfront, then you just have to believe that it's not.
Got it.
Okay. See, even I got through here through an agency, like way back, through like different portals are there. There is something called as a naukrigulf.com.
Okay.
There is something called as a Dubai Careers. That is for the public hospitals.
Okay.
For the government hospitals, you have something called as a Dubai Careers.
Okay.
Okay, for the other places, you have a naukrigulf.com. So these agencies, they'll approach to you.
Okay.
And they will have an interaction. They will keep an interview. They'll make an interview with the hospitals, and they will launch you there. But never pay upfront to anybody.
So if you don't actually, if you have 50,000 rupees and a contact in Dubai, you can actually sort out the way to the getting settled as a specialist.
Yes.
If you're lucky.
Yeah, more or three. How it works in Dubai now, that things are getting saturated here as well.
Yeah,
because many people are migrating towards the UAE, especially the Dubai.
Correct.
For many reasons. One, they are introduced the golden visas for the doctors.
Okay.
Like 10 years
what
visa.
What is golden visa?
The golden visa is a 10 years visa. Earlier, everybody used to get a 2 years visa, where every 2 years you have to go for a renewal after a medical checkup, and every 2 years you have to get it done. But now they are giving for the doctors is a 10 years visa.
Okay. Super.
Where once you get it done, 10 years, you don't have to worry about your visa or anything else.
So basically, Dubai and Abu Dhabi are saturated, but rest of the countries, I think the demand is still there. That is what we are.
Demand again, like the main dynamic population exists in these two, and of course in Sharjah as well. So these three are like more populous, you can say. And it's more of health tourism also increasing here.
Yeah. Correct.
Because if you see, what I thought when I was told when I joined, is like there will be ASA 1 and 2 patients. That's it. You'll lose the touch and all. Yeah. But of course, we accepted that and came here. And when I see now we are doing robotic surgeries. We are doing, as you said, scoliotic correction surgeries. Yeah. We are using intraoperative neuro. Whatever we were doing back home, it all depends where you end up in the Dubai hospital. I mean, like which hospital in Dubai. There is some fantastic work is going on here as well.
So that's what the people are telling. Dubai is going to become the next medical hub in the world for international tourism. So
it's already. I feel it is already on the path. Artificial intelligence is happening. Here they have already introduced, especially for the non-clinical side. Yeah. For example, giving appointments. Once somebody cancels, automatically the appointment goes for the next one. So there is no delay, no waste of manpower is happening.
Correct.
And if you see, the public hospitals are also very nice here.
Even I'm seeing nowadays a lot of specialists also they're taking, like my colleagues, neuroanesthetists also, they have gone to Cleveland Clinic Hospital and other hospitals.
Yes, yes, yes.
Even that culture is started.
Say, Cleveland, here, as I told you, transplant anesthesia also has been started here.
Yeah, correct.
Which we never thought of having it here, especially like when a few years back when we have joined here. See, as you mentioned, the Cleveland, they are doing a fantastic job here.
Yeah.
Like especially the liver, neuro. You must be knowing, from your colleagues there.
Yes, yes, yes.
Likewise here, the especially the public hospitals also, they are like on par to anything. They have introduced, as I told you, robotic surgeries, transplants,
Yes.
in the intraoperative neuro monitoring,
Yeah.
Everything. I mean, like more of the things what we used to do, joint replacements, they're all happening. Bariatric surgery, pediatric.
Yes.
You must be knowing, like that Derek sir has introduced the pediatric plastic surgery department.
Yeah, correct.
Yeah, he's doing that ETV, craniosynosis, keyhole surgeries. So more or less, it all depends in the way where you are landing up. So one thing I tell you, you just have to get into the system,
Then
being there. If
shuffle if you want. Yeah.
After MD, I suggest is like after I have done, no matter where I have done my MD. So whether in the government hospital or in the DNB in the corporate, wherever I have done, the 3 years post MD, you need to get exposed because now the era of ultrasound is coming up, and the obstetric anesthesia is very important here as well.
Got it.
In that 3 years, what you get, right, post MD or post DNB, put this 3 years into a practice where you will polish your skills, especially with ultrasound, especially with obstetrics. Earlier, we used to say this blind technique, but now ultrasound has given the eyes to anesthetist.
Correct.
Right? There's no technique is blind now.
Okay.
So everything is even we can document. Everything runs here is the EMR, electronic medical recordings. Everything flow into the system. Whatever we do, we need to explain.
Got it.
So that's how increases our efficiency as well.
Got it.
So this 3 years is very important, I believe.
So if a MD student is there and from beginning, if he is planning to settle in Dubai or Abu Dhabi, from what kind of preparation he should do from beginning only? MD or DNB?
Post MD?
Post MD or from MD first year only if he wants to get ready for Middle East. So yeah, what kind of preparation, not for the exam, as a personality, learning Arabic or learning these things?
No. See, learning Arabic, of course, have an added advantage. Especially when you work in a public hospital, where the more of Arabic speaking the patients you'll get. But otherwise, it's not compulsory, because all local people, they speak very polished English. Okay. And if you see, out of 100% of the population, if you see, only 10 to 15% are the localized, and 85% are like expats. Got so it. Around 190 nationalities are there, so they all speak English. Got so it. That should not be a problem. But of course, having Arabic language is an added advantage. A few hospitals, of course, they'll ask for at least spoken Arabic. So can we learn if we try in for 6 months, 1 year in India? Yeah. Communicable Arabic. Yes, you can. It all depends. You have to start speaking. There are few YouTube channels are there. They'll give you the basic idea of having an Arabic language. Got it. So that will get your chances high in getting into a hospital also, I think. Yes. But it's not a compulsion that not a compulsory, but if you have it, it's an added advantage. But in future, 5 years down the line, the competition is going to be high. So this can add some advantage for you in the competition. Yes, definitely. And also, when you're preparing an MD, think of taking a few exams which you can take remotely. Like, for example, European diplomas are there. European diploma in anesthesia intensive care. Yeah. Because why I'm saying this is, suppose a person who is applying with pure MD and the person another with MD and headache along with it. Headache, yeah. Though they say that headache doesn't have that much of importance there, but it opens up a few windows. Like when you go for an interview and hiring employer, they see that a person is doing just MD and somebody has done headache or something, pain medicine or some proficiency in ultrasound. they'll have an advantage over like having nothing.
Doing EDAC will help in getting your chances higher into this one.
No, I mean, yeah, getting the chances, yes, definitely.
And passing the DHA exam also, EDAC is a kind of preparation, I feel. So.
So why I suggested headache is when you prepare for an headache simultaneously, like say after MD you are waiting for 3 years, right? Or during the preparation when you are doing, prepare simultaneously for headache. You don't need any books for preparing for DHA if you are doing that, because whatever the books you are referring or reading or preparing for headache, it is more than sufficient for the DHA. The links which I sent you, right? So those are the books which I usually recommend for the people who ask me for the DHA or headache or even for the FRCA for the matter. So these are the books will cover most of it, and most of the questions they'll get repeated.
Got it. FRCA books we have to read this. EDAC and FRCA.
Yeah, and one more thing I want to add about the DHA is like suppose I initially I told you how DHA and MOH is different. So once I come to Dubai, say, but I'm getting an opportunity in Abu Dhabi. So what should I do with this? Yeah. So what for that one is like you have to stay in Dubai for 6 months. Okay. Suppose if I got into an hospital in Dubai, so but I'm getting a better opportunity in Abu Dhabi or some Sharjah or some other place. So what for that, you don't have to take another, like hard exam or some other exam. So what you have to do is that person has to stay in Dubai for 6 months in that particular hospital. And after 6 months, you have to take what is called as a good standing certificate from Dubai Health Authority. So with that, you can apply and you can transfer your data flow to whichever the emirate you are getting it. For example, Abu Dhabi. Okay. So you can transfer your license without taking an exam. But the criteria is you have to stay for 6 months at that one particular place. Vice versa. If you are in Abu Dhabi, if you want to move to Dubai, you can do that. So but you have to stay for 6 months.
Once we enter, we'll understand the system.
Yeah.
Enter into
That's what I always say. No matter what, get it in the system, you'll better understand. So if you don't like the place, sometimes what happens, you end up having some hospital, but for some reason you don't like it, but you can always change it whenever the opportunity comes. Because here, somebody who is hiring, they'll hire people who are already here.
Okay.
Because for them, it's easy to hire rather than, somebody is, in back home in India.
Correct.
So it's easy. If I'm hiring, I'll hire somebody who's already working here.
Got it. Understood. Got it. Super. I think most of the doubts have been cleared, Dr. Jamil. It is a very nice. Yeah. Any concluding points you want to tell the audience? Like that.
I just want to add, emphasize mainly, especially those who are like willing, because I have my friends who are like willing to move from the UK, Australia, even Australia. Majority of them, they are requesting, asking me from the India as well, my own colleagues. But thing is, I just want to emphasize 2 points here. One, mainly get polished with ultrasound. This thing, ultrasound is the key. Now, without ultrasound, it's very difficult to imagine giving an anesthesia, especially safe anesthesia, because the medical legal things are also coming in. One. Yeah. Second, about the obstetrics, especially with the labor analgesia. Okay. Here, almost when I was there in the private sector, almost every person, every patient, every next person is getting an labor analgesia. Okay. So this is the second point. The one more thing I have to add is about the attitude. Your attitude also, reflects and makes you stand out in the department. I feel like what we have to do, like when if I'm there in the hospital, what best I can do for my department other than giving just safe anesthesia. Like for example, you have to get involved in the taking audits, prepare trainings, like especially for anesthesia technicians, nursing staff, where anesthesia technicians are very core to us as a department. They play a very vital role in our safe anesthesia for the patients, right? So teach them, involve them in your teachings, and represent your department in the hospital if you are there within the hospital, or represent the hospital, especially when you have a debate or in the bigger
Conference.
picture.
Yeah.
Yeah, like conferences, you represent your hospital. You show that you are like, giving something additional to the department other than giving what they have hired for you.
Got it. Got it. Got it. Super. Very nicely. So in
Yeah.
that way, actually, we have to train ourselves from MD time only. All these skills, if we
Yes,
start
yes.
developing, it will help actually.
Yeah. See, I always remember one thing what, Shishi sir and Chinan sir, when they were there, especially that Shishi sir, he used to instill in our minds that, whenever you are an SR, think of an as attending consultant or associate consultant. If you're associate consultant, think of a consultant. Just same way here also, like, it will just separate you out from the other average guys. Like, you are giving, they'll hire you to give a safe anesthesia. You come, give safe anesthesia and go. But that is the minimum. What you extra you can do, that will give added to you on a long run.
Got it. Even if they
Think
don't
ahead
do,
of what, for the normal, I mean, on an average person does.
so basically these skills we have to start building up from MD first year only. Then what happens is you will be a different kind of a person by the time you finish MD. And then you can start building in that 3-year period. So by the time you enter, you'll have an edge over others. Correct, right? That's what
I totally agree. Yes. Yeah. But the 3 years post, see, in when not every MD, the curriculum, because we are more in our system is more of academics, books, and all.
Agree.
Now they are introducing the communication, soft skills in anesthesia. Everything has been emphasized,
Yes.
but it's not happening in other parts. It may be happening in like corporate setups like ours. But it's not happening other places. But whoever is doing MD anesthesia or DNB other side,
Correct.
they can come in that 3 years, be in the corporate or any place where they have tertiary skills reflected, not just refining the skills, but also definitely non-anesthesia skills as well, like leadership qualities, communication skills, attitude. These are all will be seen by the employers who are there, like looking after that.
It's actually same kind of things I will tell in my YouTube videos also. These kind of skills only I tell students to build from beginning, because once your mindset is formed after finishing, it is difficult to change later on. In the growing phase only, if they build up this kind of attitude, it will be better.
Definitely, because what happened now, it has, especially in the private sector, what happened is it has become it's like a product. They'll give you a review of the particular hospital or particular services, and they'll check online and they'll come to visit. They already know that what is happening. So you have to stand up for that. Like, it happens only with this. See, anybody can give a safe anesthesia. How differently you can approach, in the terms of like patient's comfort and all that, you have to you just have to speak nicely then. But this is what we usually don't give a highlight. Like, we don't emphasize mainly on this soft skills. This is very important now, especially it has become commercialized. Like, if you see the private hospital suites here, it is like 5-star hotel suites. They come for the same procedure. Like, let's say, for example, appendix or some surgery. But what surgery happens for 1 hour, but the stay from the hospital is for say 2 or 3 days. That 3 days they expect to have very good experience.
Good experience.
So it has become commercialized now.
Yes, correct. Exactly. So we need to pick up with the communication skills and everything.
Yes.
So corporate experience actually gives you an edge, actually, I feel.
Yeah, especially like the skills, of course you can find everybody like 5-10% skill here and there. If you have if you have exposed to that, for example, if you are doing a blocks, for you are doing intraoperative neuro monitoring, if you are doing a transplant place, the skills like 10% here there, everybody will be on par. But the soft skill will will actually make you different from others.
It will be different between individuals, actually.
Definitely, when somebody sees you that you are speaking nicely, you are giving, when they're speaking to you or they're
empathy
telling their problems, that is very important.
So that is actually not emphasized in the training phase. In corporates, we are learning because we are in a different. But how many are like us? Maybe 3 to 5% anesthetists actually get trained like us. Rest of 90% actually don't actually get trained in this way. in India.
Yeah. That's why, especially if you're here in the elite, there are elite hospitals are there where they emphasize mainly on these.
Got it.
Because the anesthesia, safe anesthesia, because we have so many gadgets now where we can give a safe anesthesia, especially the drugs like remifentanil, sugammadex, they have all came in picture. But along with that safe anesthesia, you need to have this aspect as well.
So along with pathway, you also told us how to actually excel in Middle East as anesthetist. Right now,
but it's an individual experience.
Yeah.
Everyone has a different experience in the Middle East. But what I say is, you give your 110%. If someone is asking you to work, say for example 6 hours, don't just cut off. Here there is an habit. Just don't cut off. You stay with the patient, finish the case, shift the patient in the recovery, make sure the patient has recovered, and give extra time, which is not accountable, but that is very important in the long run. That we do back home, here also, we need to continue that, and patients first. You just keep the patient safety and comfort. And you do anything here, keep these two in as a top priority. Nothing will happen. You can excel.
Then that kind of person's growth will be faster than others. That's what you're telling.
Definitely, yes. I'll tell you on the other step, my the journey of Middle East.
I think we should do part 2. One more interview we have to do.
No, that's a bit interesting, but it may be different for the different people. Some may have the bad experience initially, then they must have recovered. There are definitely, but not one place will be welcoming you with the flowers.
Yeah.
But you need to give your 110%. That's what I believe. If you are work hard, if you are true to yourself, if your patient safety and comfort is not compromised, you can excel anywhere.
Got it.
And more 2 things which I highlight again and again: the ultrasound and obstetric anesthesia, and these 2 are very important. Because we places where I'm working, it's a referral center, okay, and they'll be referred without taking in the private hospital. They'll send it to us, and we have to do it. Amputations, we need to do the orchidectomies. We can just purely we are doing in the blocks.
Oh, super.
So it differentiates, a patient, severe aortic stenosis coming for the, the infection, gangrene. They have to get rid of it before placing the valve. So nobody will take up unless you're good in the ultrasound. So just do it ultrasound, take high risk everything. So it will actually helps a lot.
Actually, there is a fellowship in Ganga Hospital and nerve blocks for 6 months.
Yes, I strongly recommend Ganga Hospital.
That's what, if they do that,
6 months, and now they have made it 1 year, I believe. That's very important.
6 months.
That will also add up to the experience. Ganga Hospital, or in Jain Hospital, in Bhagwan Jain Hospital, Bangalore, Dr. Azam is there. Okay. I mean, even we are doing more of ultrasound, right? I think Dr. Dhananjay sir, even everyone is doing.
Yes.
Yeah.
So they have to learn.
See, now ultrasound is an eyes, an eyes for the anesthetist.
Correct. So these are the.
So we are even we are doing a difficult spinal, right? We are scanning the spine. Now ultrasound is everywhere.
So basically, soft skills and EDAC, if they pass EDAC, along with that, if they have soft skills, and then if they learn skills like regional anesthesia, then sure they will enter and succeed in the Middle East. That's
definitely, once they get into the system, they will reach the places.
Got it. Super. Thank you, Dr. Jamil. I think this interview will help many people. And how to plan from first year only, we told them. So this will actually, many of my subscribers are MD first year students. So it will help them in planning their career from this part, I feel. No,
definitely you are doing a very good, this channel, which I am a subscriber also, Thank you. I usually see your content. This content was not there when we were doing back, nobody was saying where to go. We just usually come to the crossroad and we're stuck there.
Correct.
So this is very nice that you're giving an insight to the people who are following you. It's very nice.
It's good that the people with whom I worked are settling in good places. That is advantage for me. Like you.
Yeah. No, it's really nice. Yeah.
Okay, Jamil. Then we'll wrap up the session. Thank you very much.
Sure. Thank you very much, Dr. Dheeraj, for having me on your channel. Thank